TV network presents Meet the Doctors, where we introduce you to leading healthcare experts.
Hello and welcome to Meet the Doctors. I'm John Eastman. You know, if you've watched this program before, you know that we bring you some of Central Florida's most prominent healthcare professionals. Well, in the next half hour, we'll be talking about Botox, we'll be talking about back pain, and we'll be talking about breast cancer. So it turns out to be a very informative and exciting show. Let's get started, shall we? Our first guest in the studio is Dr. Brian Haas. Welcome to the show, Dr. Haas.
Thank you, John. It's a pleasure to be here.
Doctor, you are an ophthalmic plastic surgeon. Now, give us an idea of exactly what that means, ophthalmic, is in terms of plastic surgery.
Ophthalmic plastic surgeons are ophthalmologists who are additionally trained or experienced in the practice of plastic surgery around the eyes, the eyelids, the tissues behind the eye, basically the upper face and the mid-face and the tissues around the eyes and behind the eye. And we approach it from the perspective of an ophthalmologist, where function and protection of the eye is of paramount importance. But we also have a very strong cosmetic orientation as well.
Okay. Where did you get your training?
I trained medical training was at Manhattan Eye, Ear, and Throat Hospital in New York, where I did my residency training in ophthalmology and ophthalmic plastic surgery. Before that, I went to medical school at Columbia University, and before that, I was an honors graduate at Harvard University.
And how did you wind up here in Central Florida? Is that a long story?
It's a long story, but suffice it to say, I'm glad to be here.
Okay, all right. And we're going to talk today about your involvement with a very controversial subject, and that is Botox. How are you using it in your practice? And you've been using it for quite a long time, isn't that right?
Yes, John. I was fortunate to have trained in one of the hospitals where the original trials were done. A lot of people don't understand Botox was actually developed by ophthalmologists first for functional problems related to the eye, both the way the eye is turned and also spastic conditions of eyelid closure. And the hospital where I trained was one of the first hospitals in the country to be using it. So I've actually been lucky in that I've been using Botox for 15 years continuously. Really? At very high levels of volume throughout that entire time. First in the training hospital, and then after that, as the chief of ophthalmic plastic surgery at Bethesda Naval Hospital, I was the only one in the department or in the hospital that had any significant experience with Botox because of my training prior to that. So for those 10 years at training institutions, I did it on hundreds of cases a year. And since I've been in private practice, we've been using it for functional and for cosmetic use for the last 5 years.
So in terms of experience with Botox, there are a few people in this area that have as much experience as you.
That may be true.
Now, in addition to using it in your practice, you've trained others to do it. And in fact, one of the reasons 48 Hours came to visit you, was it 5 years ago?
Yeah.
Did a story about you. Tell us about that.
Well, yes, it was on a slightly different subject, but about 5 years ago, 48 Hours featured me and a patient of mine who had been burned by cosmetic laser surgery, and I had done some reconstructive lid surgery on her. And they followed us in the before, during, and after phase of our surgical treatment. And fortunately, the patient did very, very well.
Good.
She's still a patient of mine, and I've done other surgeries on her since then. She's turned out very well. And I hear from 48 Hours that this has been one of their most popular segments.
Most popular segments, yeah. Right. Let's go back to Botox for just a minute. When we say the word Botox, it makes us stop for a minute, because this is a very, how do I say it, potent drug?
Well, true.
Give us the background on it.
True. On a gram-for-gram basis, it's the deadliest neurotoxin known to man.
The deadliest neurotoxin known to man.
Absolutely.
Yet you're using it on a daily basis.
Absolutely, and safely, too. Because at the quantities and concentrations we use it at, it is very safe when used by experienced surgeons or in experienced hands. Now, that being said, I do not want to lead people to believe that there are no problems with it or there can be no complications. There can be complications. Complications can be significant. They include a possible droopy lid or a turned eye. Fortunately, if they occur, they are only temporary, just like the benefits are only temporary. In my experience, they usually occur in the hands, when they're administered in the hands of someone with less or minimal experience. In fact, I get a lot of patients who come to me. I do all my own injections. I drop all my own medication because there's a widespread concern among patients because they've heard that it's a serious neurotoxin. I get patients who come to me because other doctors actually have nurses injecting this. Some other doctors in this area have nurses inject it, And they're concerned about it, and for my patients, I drop the neurotoxin and I inject it myself.
So if I'm a potential patient
Sure.
and I really want to make sure that the surgery, or not the surgery, I should say, the treatment that I'm getting
Right.
is administered correctly, I want somebody with a lot of experience.
Absolutely, absolutely. And your risk of complications is exceedingly low. I can honestly say that we've had no significant functional complications in the past 5 years of injecting Botox.
Let's talk about Botox and what it does. You mentioned earlier, this is kind of an interesting thing about Botox, but the effects are temporary.
Correct.
Tell us about that. What does that mean?
It temporarily paralyzes the neuromuscular junction. It basically temporarily, for a period of 4, maybe to 3 to 6 months, paralyzes the muscles around the eyes so that they can't squeeze if there's a spastic condition, but more importantly, and at this point, for cosmetic usage, which is, as you know, burgeoning because of the recent FDA approval for cosmetic purposes,
Right.
Although we've been using it for cosmetic purposes for a number of years now. Again, the use for cosmetic purposes was developed by ophthalmology as well. What it does is it paralyzes the muscles that create wrinkles around the eyes and in the forehead. And by it doesn't completely paralyze them, but it weakens them enough so that it softens or eliminates the wrinkles around the eyes and in the forehead and the glabellar area. And it's quite remarkable in its ability to do this. And patient satisfaction is extremely high with this procedure. It's a short procedure. It takes about 10 minutes to do.
Really?
Or less. The complication rate by an experienced surgeon is very, very low. And there's rarely any kind of bruising afterwards. And the effects kick in and start in about 2 to 3 days, and they continue for about a week to 10 days, and they last sometimes up to 5 or 6 months. So it is only temporary, but it lasts 5 or 6 months, and it's a 10-minute procedure that can, in some cases, virtually eliminate wrinkles that concern patients around.
And the alternative prior to this was surgery, is that correct?
Correct. And in fact, for the crow's feet, the area around the eyes, in fact, in my experience, surgery there has never been as good for crow's feet, those wrinkles around the corners of the eyes, as Botox has been. Botox is better than surgery for that.
And let's talk about recovery time, too, compared to other procedures.
There's no recovery time. I have patients who come in at 7:30 and go to work later that day.
The same day?
Same day.
The same day.
Absolutely.
Are you finding that this is becoming more and more popular as the word is getting out?
Well, with covers on Newsweek and the Sunday New York Times Magazine, it's just, interest is just mushrooming. And I think it's a great thing for everyone, including the patients who have functional complaints, because the more people know about it, the more they'll understand about it, and the more they'll understand that it is a safe and very effective cosmetic procedure, but with certain caveats, as we mentioned before.
And those caveats are primarily that you have to be in the hands of somebody who has a lot of experience, because this is, number one, it's a very dangerous neurotoxin.
Correct.
But in the hands of an experienced surgeon,
Risk is minimal.
risk is minimal.
You know, complication that a droopy eyelid or double vision in a cosmetic patient is a significant side effect, even if that's temporary. And the way to avoid that is to make sure that, the way to avoid that is to make sure that you're in the hands of someone who's very experienced.
Dr. Haas, we have a lot of viewers right now who probably are sitting on the edges of their seats, who have been thinking about looking into Botox. If they want to call your office, if they'd like to find out more about how to reach you and how to schedule an appointment, how do they do that?
Well, my address and phone numbers, I think, up on your monitor. They're welcome to call us. We have we put aside a special time slot early in the morning before working hours for our professional patients. That segment of our population is also mushrooming, and so we have a time before regular work hours where we can see patients, administer the Botox, and get you back to work on time, and so it really disrupts your day or your week minimally. So we try to accommodate our patients as best we can.
Dr. Haas, thanks so much for being on the program today.
Thank you, John. It's been a pleasure.